Hello guys, what's up my people? Welcome to Talk to Your Midwife session. Now today I want us to learn about the BP levels or the normal ranges of the blood pressure of a normal human being who is not sick, just a normal human being. Now let's see how we. So BP is recorded in two readings and the normal range is 100/60 to 135/85. This is the range of a normal person, 100/60 to 135/85. So any person, any patient who will have a BP of less than this, less than 100/60, most of these patients you will find they are encouraged to take a lot of water, or even the doctors will maybe put a drip. If they are in the ward, they will put a drip for them so that at least the blood pressure can be quite raised up to the normal range. So any patient who has a BP of more than this, 135 and above, 85 and above, any patient with such a BP higher than this, we will measure the BP for like maybe 3 days, morning and evening, without any medication. And if we see that the BP is still on that higher level, now we can conclude that the patient or the person has high blood pressure, or the BP has hypertension, which is about to maybe to come. For patients who are known to have hypertension, this one is even a bit lower. For them, their range is quite higher. We give them for up to 140/90. So a person who is hypertensive and has a BP of 140/90, that BP is normal according to them, because they already have blood pressure, high blood pressure. A BP of 140/90 is a normal BP. So guys, we have a lot of things that causes high blood pressure, including even pregnancy, especially the gestational hypertension which occurs during pregnancy, and then diseases. Then there are those people who like inherit the high blood pressure from maybe their parents. That is genetic hypertension. Then some of people who have infections and diseases, they will manifest through temperature and also through high blood pressure. So those are some major things. And alcoholism and drug abuse also contribute so much in high blood pressure. A lot of people ask about treatment. Now, treatment depends on the specific cause or on the contributing factor of the high blood pressure. If the cause was disease or infections, we have to treat the disease and the infection so that the blood pressure can go to normal. If it is genetic, we might not be able to finish that or to completely get rid of it. So you find most of these patients might end up using medication for quite a long time or for a lifetime. Patients who have chronic hypertension will mostly take their medication almost lifetime. But just note this, not every person who has hypertension ends up taking hypertensive medication for the rest of their lives, because most people fear starting the medication therapy because they think that they might take the medication for the rest of their lives. So do not fear to start your treatment. The main thing, the most important thing is you go for regular checkups of the blood pressure and also for further investigations. You may mostly the basics medication, the basics lab tests that we do is the kidney function test to see whether your kidneys are okay, and the liver function test. Those guides us mostly to see whether you have any underlying disease of maybe a major organ in the body that might be causing the high BP. So go for regular checkups as you continue with medication, regular checkups and medication, and allow the doctor to take their time to find out more, to learn more about your high blood pressure, so that they can know how to manage it. Because as long as there is an underlying cause and maybe you're treating only hypertension, you might end up even complicating more, because already you have an underlying cause of the high blood pressure. So we need to know, we need to do further investigation. understand that even the medications that you're taking are part of our investigation. We want to see, because there are so many types of medications that are used to treat high blood pressure, and those medications, they work on different parts of the body. So when we start you on that medication, we want to see, is this medication really working to lower the blood pressure? If not, we might change it to another type. So, and also that will guide us on maybe a specific, it will maybe help us get a specific cause of your high blood pressure. Another thing we need to know is that blood pressure is like an explanation. It is like an explanation of how our heart is beating, how the heart is pumping blood to the rest of the body, to the rest of the major parts of the and major organs of the body. So it is something that is very, very crucial, and it can be life-threatening if it is not well treated and if it is not managed as early as possible. Another thing we need to know is that blood pressure is like an explanation. It is like an explanation of how our heart is beating, how the heart is pumping blood to the rest of the body, to the rest of the major parts of the and major organs of the body. So it is something that is very, very crucial, and it can be life-threatening if it is not well treated and if it is not managed as early as possible. And hence, this means that we need to treat this blood pressure before it goes to destroy other organs of the body. Remember, the heart is one of the major organs of the body, and this heart is pumping blood to the other major organs of the body, like the brain, the kidneys, the lungs, you see. So in case the high blood pressure is in case we have high blood pressure, it means the heart will pump blood with a very big force to the major organs of the body, and hence it might end up destroying the other organs of the body. And that's why you will find people who have been having high blood pressure for quite some time, which is not treated, they end up getting a sudden stroke. There are those patients who like they have never been taking antihypertensives because maybe they never went for checkup, so they have been having silent high blood pressure which has no signs. Then immediately they just find themselves with stroke. That is the reason. So you find they have been having the high blood pressure, the blood has been pumping at a high pressure, maybe they get to the brain, the small vessels in the brain, they end up bursting or they end up enlarging so much, and that alters your body posture, your body movement, and you just end up having the stroke. So it is good to manage high blood pressure as early as possible so that we tend to prevent such complications like stroke and even death. Now, for those people who are at risk of getting the high blood pressure, the people who have relatives or parents who have been having high blood pressure should always go for regular checkups. Pregnant women, as long as you have realized you're pregnant, start your ANC clinic and get checked of all other infections and diseases, including the high blood pressure. You make sure that you checked your blood pressure each time you go for an ANC clinic. Women who are not pregnant but are using contraception or any family planning method, especially the hormonal family planning, should make sure that at least you get your blood pressure checked after maybe every 2 weeks, and before even starting that hormonal contraception, ensure that you have tested your blood pressure. And the reason why you should go for regular checkup is because some of these hormonal blood pressure hormonal family planning, they lead to high blood pressure. That is why you need to go for regular checkup, so that in case the blood pressure is increasing, you can remove your contraception or your family planning that you're using, or stop using them. Also, men who are drunkards or alcoholic men and women, Those who have been using drugs, those who smoke cigarettes, make sure you go for regular checkups, because these can also cause high blood pressure. Then those people who are obese, or the heavy duties, the heavy bodied people, be it women, be it men, ensure that you get your blood pressure checked regularly, because that is also a contributing factor